Snoring puts a great strain on relationships. It can also develop into a serious medical condition, causing the snorer to stop breathing. And we regularly see this here in the sleep laboratory at the Ear, Nose, Throat University Hospital of Mannheim. How does the annoying snoring sound develop? When sleeping, the uvula and tongue fall towards the back wall of the throat and the air passage narrows. When breathing during sleep, the soft parts within the middle throat area begin to vibrate, creating the typical snoring vibrations. In most cases, snoring does not require any special treatment because apart from the noise disturbance for the sleeping partner, it does not represent a health risk to the snorer, and the organ systems are sufficiently supplied with oxygen. This pattern of snoring is referred to as primary or habitual snoring. On the other hand, snoring may be a symptom of the more serious obstructive sleep apnea syndrome, which ranks among the sleep-associated breathing disorders. Patients with obstructive sleep apnea can exhibit several hundred breathing arrests nightly that lead to oxygen deficits and disturbed sleep architecture. These patients suffer from excessive morning and daytime sleepiness. Before treatment is given, a differential diagnosis to determine primary snoring or obstructive sleep apnea must be made. The diagnosis will be made after a full history has been taken, with a clinical examination, and either an ambulant sleep screening or a sleep laboratory study, which may include full polysomnography. Depending on the results of these examinations, treatment with a mandibular advancement device is a possible therapeutic option. SomnoGuard is a thermoflexible mandibular advancement device that reduces snoring and nocturnal breathing arrests due to sleep apnea by extending the lower jaw forward. The pack contains mouthpiece, modeling strip, wooden spatula, and storage case. Before heating the device and final fitting, the whole process should be practiced with cold water. We recommend that SomnoGuard is only fitted by your doctor or dentist, or their trained medical staff to avoid failures caused by fitting problems. Sufficient experience assessing intraoral and dental conditions is very important. Before fitting, teeth and jaw conditions should be inspected carefully. It is imperative that the patient has at least one clear nasal airway, and the patient under normal jaw conditions should be able to bite on the plastic with the upper and lower front teeth being in vertical alignment. When heating SomnoGuard in hot water, it is very important to ensure that the immersion time specified in the user instructions is followed accurately. After heating, an edge of the device should be squeezed to see if the plastic can be molded easily. This procedure must be carried out within 15 or 20 seconds after removal from the hot water. Subsequently, with the help of the wooden spatula, SomnoGuard is inserted carefully into the mouth with the notch at the top. The lower jaw is first positioned into the lower channel of the mouthpiece, then the upper teeth carefully in the upper channel. The mouthpiece, which should still be flexible, is automatically adjusted to the width of the jaw arches. The patient should now move the lower jaw forward by approximately half the maximum extension possible and bite on the plastic hard. While doing so, the fingers should be used to press on the outer walls of the mouthpiece and make sure it is molded properly, especially in the wall area. After approximately 30 seconds, the mouthpiece can be removed and immersed for 10 seconds in cold water in order to fix the fit. If all the steps have been followed correctly, you will be able to see distinct teeth impressions throughout the whole mouthpiece, and the border walls should not be damaged. Only then will the mouthpiece lightly grip the patient's teeth and stay in the required position during sleep. After removing the wooden spatula from the opening, the proper fit should be checked again. Having the lower jaw extended forward should still be comfortable. If it is not, the fitting process can be repeated up to 3 times. With some patients, no distinct impression of the teeth can be seen in the molar area of the appliance after the first fitting. If such a deep bite is diagnosed, the molar area can be raised with the filler material in the pack. When raising the molar area, it is necessary for both the part of the appliance that needs correction and the filler material to be immersed separately in hot water for approximately 15 seconds. The soft and warm filler material can then be pressed in the biting channel at the appropriate place. The remaining material can be used, if necessary, to raise other biting zones of the mouthpiece. Usually, it is only necessary to remodel one biting channel to achieve a good and equal jaw impression in both channels. After fixing the filler material in the biting channel, the corrected part of the mouthpiece has to be immersed in hot water for approximately 20 seconds. The patient then bites into the appliance carefully without moving the lower jaw forward. After insertion in cold water to fix the mold, the oral device is ready to use. A distinct impression of both teeth arches should now be visible in both channels of the appliance. In case of dental diseases such as parodontosis, retrognathia, full dentures or missing teeth, the device should always be fitted by a dentist. Patients suffering from jaw joint problems are advised not to use SomnoGuard. Approximately 6 to 10 weeks after fitting and the patient's habituation to the device, therapy success should be evaluated by ambulant sleep screening or sleep laboratory examinations. The performed clinical investigations at the sleep lab of the Ear, Nose, Throat University Hospital of Mannheim and at other sleep laboratories demonstrate that SomnoGuard is a very inexpensive, safe and effective mandibular advancement device, at least for the temporary limited treatment of snoring and, under close medical guidance, obstructive sleep apnea.